I'm excited to talk today with Dr. Melissa Durfey. She is a doctor of acupuncture and Chinese medicine, as well as a licensed anesthetician. In addition, she's a wizard with topical herbs and, more importantly, welcomes everybody into her clinic with love and compassion. Melissa, welcome.
Thank you so much for having me. It's always such a pleasure to talk to you. I've had so much fun with you ever since master's program.
Yeah, so if people don't know, Melissa and I first met, about 15 years ago?
15 years ago. Mm-hmm.
Yeah, doing our master's degree program over at the Oregon College of Oriental Medicine. So how's life in Sonoma County?
I love Sonoma County, but you always knew my passion for wine and local businesses. The local business community here is really phenomenal, and the restaurants are out of this world. Tons of wonderful options for people with dietary restrictions too, which is really neat.
Yeah, I've moved to Connecticut, and it's not so much that way out here.
I was just about to ask you that.
There's a lot of pasta and hamburgers and fried food. But there's also a lot of really good seafood, like shellfish and stuff like that. So, yeah. One of the things I want to talk to you about is let's go back again to that 14, 15 years ago.
All the way back.
I remember going to your apartment, and when I walked in, there were bubbling cauldrons mixing all of these. They were probably crock pots, but I like to remember them as cauldrons. And you were mixing all of these herbal decoctions, topical back then. And we were really just learning about herbs at that point in the master's program, but you were already mixing. I think you were starting your Melissa Bomb, and you had Baiji Bomb going, and you had all these other things going already. One of the things I wanted to ask you about, what's your process? When you create an herbal formula, where do you start?
When I create an herbal formula, I start with a need. If I see something that needs to happen, then I go into my brain palace and see if it's something that I can noodle out. So as far as Melissa Balm goes, I was allergic to a lot of the topicals that we were using in Tui Na, which is Chinese medical massage for those of you not familiar. I was highly allergic to all of those fun oils that I assume smell really good, but they don't smell good to me.
They never smelled good to me either.
Okay, so it's not just me, but
some of them actually had turpentine in them, but we don't need to talk about that.
Well, so I guess I wasn't missing out too much. So I wanted a medium that I could use for Tui Na, and for cupping and gua sha and all of those wonderful bodywork techniques that we learn in acupuncture school. But I couldn't use any of the things that we were using in class. So that was where Melissa Balm came about. Yeah. I have a little bit of a background in Western herbalism from undergrad. So I just sort of gently started with a Western formula, but looking at it in a Chinese medicine sort of way because we were learning that. And so that product came out of necessity. My second product, which is Burn Balm, which is a version of Shinko, which is used a lot in Japanese medicine, that came out of me not wanting to use lard in the formula. And I know that lard is one of those magical things that actually make it work, but we had a ton of vegan students at OCOM. And so that came out of necessity of some of the vegan students wanting an option. So that was where that product came.
And you sent me some of your Shinko.
I did.
People who know me know that I am a Shinko snob. All things moxa, I'm passionate about just using the best ingredients. Um, I have to say, I tried it yesterday,
Oh
and
yeah,
you're
you
the
got it.
first person to create a vegan Shinko that doesn't just turn into grease.
Nailed it.
I think you succeeded. I have tried so many other attempts at vegan Shinko, and I make my own because I can't find traditional lard-based Shinkos.
Mm-hmm.
I think you did it. I actually think you did it.
Well, this specific batch that I sent you is not entirely vegan. I have to preface that because
Uh-oh.
it does have amazing local organic beeswax in it.
Okay.
So
vegetarian but not vegan.
Vegetarian, not vegan. I do make a vegan version, but I know that you are not. So I sent you the one with the beeswax in it just because I think it adds a little extra goodness.
Yeah,
I
think
the wonderful healing properties of beeswax.
So do you start generally with a classical formula and then modify it, or do you just kind of start whole cloth, like from scratch?
Yes and no, depending on the product. So, for example, my Indigo Balm, which is a version of Qingdai Gao, I took that traditional formula, took the petroleum out of it, and then noodled on how I'm going to get that texture without the petroleum.
Okay.
Yeah. Like I said, Melissa Balm was born out of my Western herbalism, and some of the bespoke products that I make in-house here in Petaluma, those are all a mixture of classical formulas and what the client is really looking for. I mean, I definitely use my classics as a jumping off point, even if I'm just inspired by them, not even necessarily using the herbs per se, but using the, I guess the Duyao.
Yeah. Yeah. And I think that's the way to go. I supervised over at the Oregon College of Oriental Medicine for a little while in their clinic, and students would often try to just design a formula from nothing. And I always, a classic's a classic for a reason.
I say that all the time. The classics are the classics for a reason.
There is no reason to reinvent the wheel every time you make an herbal formula. Yeah.
Preach.
Yeah. Yeah. So one of the other things, I know when most people think of cosmetic acupuncture, they think of 300 tiny needles in the face, jaw, eyebrows, eyelids, cheek, wherever, everywhere on the face. But I know you have a different approach, and I know it's an approach that you've kind of developed on your own over the years. How does it differ?
Yeah, so this is a great question because I get it a lot. And you do see like pictures online of people with like 100 needles in their face. One of the standard like protocols, which, I don't believe in cookbook acupuncture, but that's a whole nother conversation. But the protocol that I learned when I first started studying cosmetic acupuncture had 92 needles in it, which is absolute insanity, right? So the reason why beauty puncture, which is my trademarked system, is different is because it's based on a combination of both Eastern medicine and Western aesthetics. Now, because of that, we really do look holistically. People are coming to you for help with their wrinkles. Now, why do wrinkles occur? Deficiency. Do we want to put a ton of needles in a patient or client who is deficient? Probably not.
I probably wouldn't.
Right. You can blow them out of the water. So taking a gradual approach, treating the true root cause rather than slapping the Band-Aid on with the
Mm-hmm.
protocol, I've found that in the long run, we get better, more consistent results.
Mm.
I also think it's huge to add in additional modalities. As you know, acupuncture in this country, especially, they think that needles is all there is.
Yeah.
When really, it's only one pillar of the pillars of Chinese medicine, right?
Right. Yeah.
So by utilizing the other tools in our tool belt, including your tools, Mark, uh, we can get superior results to those people who are blowing people out of the water with 150 needles in their
Yeah.
face and body.
Yeah. And I think that's really important. It sounds to me like you're trying to treat the root as well as the
Exactly.
symptom. And the symptom really is they're coming in for the symptom. They're coming in for the wrinkles, for the cosmetic approach, which is a symptom. It's not the
Right.
issue. Yeah.
Well, that's how you get them in the door, right? I
Right.
mean, that's what the Instagrammable before and afters is what sells.
Yeah. Yeah.
But when it really gets down to it, it's about longevity. It's about preserving and enhancing and tonifying chi and essence.
Actually, I want to go back to something you said earlier. Um, you mentioned you don't believe in protocols.
No,
Can you tell me why?
because everyone's different. You can definitely use a protocol as a jumping off point, just like you can use a formula as a jumping off point. But I think that point prescriptions, or however you want to put that, I feel like it doesn't take into account the nuances that each individual person who walks through your door
Yeah. Yeah.
has.
I know we've talked about this before. We both like the classics.
Mm-hmm.
You mentioned to me last time we spoke that your beauty puncture system comes from the classics.
Yeah, the some of the needling styles are from the Huangdi Neijing Su Wen,
Right.
and a lot of it, a lot of what I do in beauty puncture really comes from those original treatises on Mei Rong, or you know,
Yeah.
beautifying oneself. I use a lot of like imperial secrets or whatever you want to call
Right.
them, but
Yeah.
uh, as the basis of where I started with research.
Yeah.
And there are a lot of other trademarked systems out there that shall remain nameless that attempted to trademark the needling styles, and all I have to do is just shake my head and laugh about that a little bit, because you cannot trademark something that was written a long, long, long time ago.
You can try.
You can sure
there,
try,
there,
but
there was somebody that
ethically
tried to basically
speaking,
patent gua sha in the 70s.
yeah. I mean, I, yeah. Well, I mean that would take us into the whole like dry needling conversation, which I just had with someone this morning.
Yeah.
Uh,
Yeah, I think it's a lot like herbs, where you can start from classic formula. Your
Absolutely.
acupuncture should start with classics. And from there you can grow and learn. But you need a basis. And
Exactly.
there were no I'm sorry, there were no actions and indications in the Ling Shu.
No,
Do you remember seeing any?
no, I don't remember seeing any of that.
So I also remember that in our master's program, there were a couple teachers that didn't necessarily support you the way they could have with your ideas.
Oh, of course not.
And I know that you hit, after graduation, I know you hit some roadblocks that really were not under your control, that were setbacks, and you've had several setbacks. But when I look
Yeah.
at what you've achieved now and where you are treating people, you're right where you said you would. Like, you're just pushing through. What advice would you give to acupuncture students right now that are either about to graduate or going through the program and maybe feeling like they're not being heard?
Know who you are and keep working towards that. Know where you want to go and build that golden path. I think it was Lillian Bridges who really turned me on to the whole golden path concept of just, if you know that you are put here, or whatever it is that you believe in, if you to make a difference in a certain aspect, the medicine is huge and there's room for all of us and there's room for different ideas. And just because you weren't supported in school with said ideas does not mean that you will not be successul.
Now, I do want to just clarify, it wasn't all of the teachers.
No. I had some amazing
one in particular that I think
who shall remain nameless.
Both of us to a huge extent, and we will forever be in Ken Gawatski's debt.
Absolutely.
Yeah, he just really helped us out a bunch, and there were some other really good teachers over there.
There were some amazing professors at OCOM, and I've had some spectacular professors in my journey at Pacific for my doctorate. Dr. J stands out. I just have to name drop him a little bit. Dr. Jovanovic.
Yeah.
I probably butchered that, but that's why we call him Dr. J. He was a phenomenal professor and was super encouraging of everything that I have been doing in the medicine and that I plan to do in the medicine. And the dean over at Pacific was super supportive as well.
Yeah, and I think this goes, just to mention, if there are any teachers from any of these schools listening to this, what you say matters. What you say makes a difference.
100%.
Keep that in mind always.
And just because you might not necessarily get it doesn't mean that there isn't a whole lot of people out there that will.
Yeah. So that's one of the other things that I know about you. I know you are an extremely warm and loving person. And that's one of the things I think that defines your practice and kind of defines the vision that you have, or that you've at least expressed to me in the past. Mm-hmm. And that's being all-inclusive. That's being
100%
non-judgmental of who people are.
Well, if you look at all of the stigma in the medical community, Western, Eastern, doesn't matter. But all of the stigma, medical stigma, I did a narrative review on this in my doctoral program. Stigma makes people avoid medical care. We're there to take care of our clients and patients. We should be meeting them where they are and not shaming them for what they are not.
Yeah. And
I believe that so deep. It's one of my core values. And I really believe that, especially us Eastern folk who look at everything so holistically, really should be mindful of all of the medical biases out there.
Yeah. And we're practicing a medicine that the tenets of it were written thousands of years ago. The times have changed.
For sure.
Medicine needs to keep moving forward, even though we're doing a traditional medicine, whatever that is.
Whatever
I don't know
that
how
means.
you do a traditional medicine as a modern person, but okay.
Exactly.
We need to move forward. And one of the ways of doing that is to work towards getting rid of these biases. And it doesn't matter whether it's sexual orientation, whether it's body shape, whether it's race, or even just being male or female.
Yeah.
And even that definition right now is a hard one to state.
Well, gender expression is a spectrum.
Absolutely.
And, I think even the classics acknowledge that to an extent. Well, you have to read between the lines a little bit, but, I believe that, yin and yang is infinitely divisible. So.
Yeah. And I think that's the point of yin and yang, isn't it? That people look at, I was listening to a really bad podcast on logic. It was a guy that was talking about logical fallacies, and he was trying to analyze yin and yang as a logical fallacy of an either or kind of false dichotomy statement, and he clearly did not understand what Tai Chi meant.
Yeah,
you can't have yin without yang and yang without yin, and that's
there's 5 whole principles about that. I just uploaded a video.
And where can people find your video?
Oh, I'm on YouTube at my self-care doc.
All right, my self-care doc, and I will definitely put a link below on how you can find Melissa and all of her topical goodies. How can people do a better job welcoming everybody into their clinic? How can we serve these underserved communities?
Empathy, of course, but reading and following people who are different than you on whatever platform you follow people on. Listening to some, fat liberation podcasts is always a good way to go. Reading, if you're an academic, there are tons of studies that have been done about medical bias that you can noodle over, and just get educated. Really, just learn about different ways of communicating with people. Learn their terminology if they're different from you, if you aren't familiar. It's not super hard to find. There are tons of resources out there. I'm sure there are entire channels dedicated to it.
Yeah. And I would say don't be afraid to ask. If you ask respectfully, out of a place of actually caring, people will educate you. They'll tell you what you need to know.
Right. And for the acupuncturists out there, or other types of East Asian medical professionals, or even medical professionals in general, making sure that your intake forms are inclusive is something that can completely change your practice.
Yeah.
And, the easiest way to do that is to, instead of having someone check a box for male or female, you put gender and a blank line.
Mm-hmm. Yeah. Yep.
And there it is. It's as simple as that for a provider to make their practice 100% more inclusive, just by that simple action.
Yeah. And I think that if we can all keep that in mind in our practices, we can make a huge difference in the world. I think where there are a lot of Western practitioners. Some are phenomenal. Some are absolutely excellent. The system itself of Western medicine has embedded biases in it.
Mm-hmm.
We, as an alternative to those providers, have an opportunity to make a big difference.
Exactly.
Big difference. Yeah.
Exactly. We can become a beacon of light to all of those people, and that's really a big part of my practice and why I put my messaging the way that I do, because I am always happy to be the one to take a second look if your doctor is convinced that your arm pain is because you need to lose weight.
Yeah.
And I have seen those cases. I have had someone come in with lateral epicondylitis, and they said that my doctor told me to lose weight, and that was the only advice that they gave me.
I had a patient a few years back. This is kind of the opposite end of the spectrum. She is probably about 90 pounds, tiny little woman. And her doctor was typing away at their keyboard and not looking up, and saw on her test that she had high cholesterol and told her to lose weight.
From where?
She was sitting in front of her.
Yep.
The doctor never looked up. The doctor was just typing away and said, "You've got to go on a diet, you've got to lose weight, your cholesterol's too high." This person, if they lost any weight, would not exist.
Oh, that's so heartbreaking to me that they use that as a one-size-fits-all Band-Aid for every ailment under the sun. And it's not the cure. I can tell you, just personally speaking, as someone who has been all over the spectrum due to various autoimmune conditions and all sorts of fun challenges, and have been on all sorts of medications and now all sorts of herbs, that things actually got worse when I was in a thinner body.
Mm-hmm. Mm-hmm.
So
yeah,
that's a little interesting tidbit. I know that I'm not the only one out there. I've actually just recently worked with someone who had non-alcoholic fatty liver disease, and they had just lost a significant amount of weight, but their doctor was telling them to lose more. And it was another case of from where.
Yeah.
And they offered her no other support as far as, oh, here are some dietary changes that we can make. So, I handed her a whole bunch of fun Chinese medical recipes that she can add to her regimen. And we got her on some herbs, and we got her on some supplements. And just the fact that the Western physician didn't even look anything up,
well, their training's not there.
Or refer them out to someone who does have the training.
Right. Yeah.
That would be the ideal situation,
that would
right?
be the ideal situation.
But, that's the system, and that's a whole other ballgame.
Yeah. Yeah.
Since you moved from Oregon to Connecticut, have you noticed from a Chinese medical perspective any constitutional differences?
Oh, the people are completely different. The people are completely different here.
Mm-hmm.
In Oregon, you give everybody moxa all the time.
Isn't that the truth?
That is kind of my mantra. Out here, in the summer, it's really hot. Mm-hmm. Even in Oregon, when it's really hot, the people still need the moxa. Over here, when it's hot, people don't need the moxa. They're fired up. They've got enough of that jing moving in their body. They don't need it. In the winter, it gets cold here, but it's not that wet damp. Mm-hmm. So people aren't under constant invasion that you see in Oregon.
So in a nutshell, you're seeing less dampness, less phlegm.
Well,
maybe not.
Less dampness, less phlegm from external sources.
Right, that was what I meant.
Here.
I mean, we all create that internal dampness. That's an American condition.
Yeah, there's a little more of an emphasis on healthy eating on the West Coast, I think. Out here, not so much. People eat what they like. A lot of pasta, a lot of bread. At least that's my experience, and maybe that's just my family. But
well, our family do set, habits and preferences for us.
Yeah.
So, that there is a grain of truth to that wherever you are. But I've noticed since moving down here to California that it's even more of a local food movement than even Portland was.
Yeah.
Because we grow everything here in Sonoma County.
Uh-huh. Yeah. Do you have any advice you want to give to any other acupuncturists out there, just as a last word? I want to give you the last word.
Don't forget to take care of yourself, because the only way that you're really going to be able to be fully there for your clients and your patients is for you to fill up your cup. So take your herbs, do your qigong, meditate, make sure that you are getting ample rest. I know that's hard to say, but make sure you're getting ample rest, but also time to play. Play is so huge, and do something that you enjoy.
Yeah, I think.
And it will all come.
A lot of people have forgotten how to play.
Yes. I've noticed that in my own practice, because I always ask people, what do you do for fun? And the number of clients who stare at me after I ask them that question is kind of sad.
All right, Melissa, it's been fantastic talking to you. I think everybody should take this opportunity to go do something fun right now. I will put all of Melissa's contact information, her website, and her YouTube channel in the section below. And Melissa, it's always a pleasure to talk to you, and I will talk to you again soon.
Absolutely. Always a pleasure. Thank you so much for having me today.